We finally have some good news. Overall, new COVID cases across the UK are declining, which suggests this current lockdown is working. However, that doesn't yet mean we are past our darkest COVID hour. That's because, as we all know, hospitalizations and deaths lag infections, and we can expect both to increase significantly in the coming 2 weeks. Why that's particularly worrying, particularly problematic, is because unlike the first wave, we are already reaching, already hospitals are way past being more full than they can handle. There are currently 70% more COVID patients in hospitals than there were at the peak of the COVID first wave. So can our health service avoid collapse? I'll be joined in a moment by Silas Webb, an A&E doctor in a North London hospital. Also on tonight's show, I'll be speaking to Sage advisor Professor Susan Michie about our government's failure to provide adequate financial support for those who need it. We've also got the latest on Richard Leonard's resignation as Scottish Labour leader, news on Toby Young being rebuked by Ipso for telling COVID porkies, and Jacob Rees-Mogg citing happy fish as the Brexit silver lining. It's all a little desperate. As ever on a Friday, I'll have Dahlia on hand throughout. How is week 2 of lockdown free treating you?
Oh, I mean, it's okay. I feel like this lockdown is so much more like monotonous than the first. I don't know why, but it just feels that way. And it's been really shit seeing so many of my friends and family having to go into work when it's just not necessary. But it's a pleasure to be here because it gives me an excuse to do my hair and put my makeup on once a week, which if I didn't have this, that wouldn't be happening at all. And I would be looking like a gremlin at all times. So it's nice to remember that I can look like a human again at some point.
I'm very pleased to be able to provide you with an excuse to do those things. As ever, share the show link, tweet your comments on the hashtag #TyskySour, or put them in the super chats. We'll be reading them throughout the show. I want to start this section quickly by doing something we often do at the start of these shows, go through the latest statistics, and I'm going to particularly focus on the levels of hospitalizations. So the following graphs are from Independent Sage. So they did a briefing today and they put out these slides. The first one is the number of new hospital admissions with COVID-19 per day in England to the 12th of January. So this is the number of people admitted to hospital every day. It was 3,099 people per day at the peak of the first wave. It's now 4,134 patients per day going into UK hospitals. So you can see that's 25% higher than it was then. The next slide shows us how this breaks down on a regional level. So you can see that in London, those hospitalizations have just been rocketing recently, potentially falling ever so slightly in the past couple of days. Some really interesting facts on here. They say critical care occupancy in London and East is double what it was in 2019, with critical care occupancy in London higher than in the first wave, and hospital occupancy 50% higher than in the first wave. So all looking pretty worrying. There are already 37,282 patients in UK hospitals. That's over 70% more inpatients than there were at the peak last spring. What makes all of this worse? 15,000 staff across London's healthcare network are currently off sick, the majority linked to COVID. Now, this all seems an impossible situation. And to fill us in, I'm incredibly grateful to be joined by Silas Webb, an A&E doctor at a North London hospital. Silas, thank you so much for joining us.
Hello.
I'm especially appreciative because I know that you're speaking to us immediately before you go to do what I imagine is going to be one of the most stressful night shifts of your career so far.
Yeah, no, apologies if I'm slightly bleary-eyed. I woke up about half an hour ago and just having my breakfast, which is a strange time to do it. And thanks for also reminding me of those graphs that what I've got prepared for me.
Oh, sorry about that. So it's one of the few professions where waking up late in the afternoon is nothing to be embarrassed about. I want to start by talking about this concept of the NHS being overwhelmed, because we often hear, that the NHS is at risk of becoming overwhelmed. We need to obey the lockdown rules, which we do, to stop the NHS being overwhelmed. But when I hear about what's currently going on, ambulances waiting for hours, cancelled operations, staff to patient ratios sort of plummeting, does it feel to you that the NHS has already been overwhelmed, or does that still seem to you like some possible event that could happen in the future?
I think from my perspective, and kind of speaking from my work over the last week, it's been relentlessly busy. So I've been working kind of solely in the COVID part of my emergency department, because we're just having to split shifts because you're just needing kind of a whole workforce just to look after COVID patients. And we've been kind of getting back to back blue light ambulance calls. So they're the highest priority patients needing kind of urgent assessment and treatments. And we've already seen kind of the videos on the news of kind of people waiting 20 hours on beds, waiting to go to a ward, and ambulances kind of queuing up outside. And it's all a reality that we're living and seeing every day. But I think that the kind of question of the NHS collapsing is slightly more nuanced than people are trying to make it out to be. And I agree. I think that it's a system that's already in the process of collapse, and this is an attritional process. And as we're kind of gradually siphoning more and more resources away from kind of essential time critical bits of care that we usually provide, that for me symbolizes collapse. So the fact that people are struggling to get so many GP appointments, patients turn up to A&E, then the A&Es have to go to divert because there's not enough space at the front door. And this is what happened to me 2 shifts ago, where just as we'd got to a point where I thought we might have got patients under control and was having kind of seeing people in a timely manner, 2 of our local hospitals went on to divert. So all of the ambulances that would be going to there came to us, and that just meant that we were inundated. And then I think kind of taking one step further than that, there's no hospital beds for people to go to after they've kind of, so that's why operations are being cancelled. It's why urgent cancer operations are being cancelled. And all of those represent a system in which I don't think people are able to kind of get the care that we'd always like to be providing. And that shows that that's symbolic and symptomatic of a collapsing system.
I mean, do you feel that people in the health service have been frustrated at the way that sort of when Boris Johnson makes these decisions, he says, oh, it's only now that with this new variant, it seems like the NHS could be overwhelmed. So now we have to bring in restrictions. I mean, I suppose was hearing language like that as if being overwhelmed was something in the future, something that hadn't happened. Does that frustrate people on the front line? Or is there such a sort of tunnel vision, do your job, get it done, that you kind of block out those discussions that are happening in the outside world?
No, I mean, I think that we all talk about it. It's kind of, at least when we're going to work, we're able to be kind of more social than most people who are in isolation. So we're constantly discussing these things while we're trying to get on with the job at hand. And I think that it's, I think it feels like too little, too late. And I think the fact that by the point that we were kind of being told on a kind of political level that the NHS was about to become inundated, we already had intensive locations in London, and kind of intensive care by the nature of what it means that it's kind of nurses providing one-to-one care at max 1 to 2 patients. And I think as soon as it becomes beyond that, then you can provide intensive therapy. So that's kind of putting people on ventilators or giving them dialysis. But is it really the care that we aspire to? No. And I think that it's kind of, we're way beyond that point now.
I want to focus on the next 2 weeks because I think people quite rightly, and our audience will be able to work out why, looking at the graphs I just showed people, it's going to be the next 2 weeks, which everyone says will be the NHS's toughest test. I expect everyone working on the front line is very, very nervous about what's going to happen over the coming 2 weeks. From your perspective, again, because this can all seem quite abstract for people who don't work in the health service, what does a best case scenario look like? What's the situation where after 2 weeks you're like, we got through that, maybe by the skin of our teeth, but we got through it? And the worst case scenario where it's, absolutely the one thing we don't want to happen is happening.
Again, I'm not sure, because I think that this again represents this kind of process of, we will, I'm sure, find an extra bed or an extra kind of space to see someone, albeit kind of in a place where that person is kind of not traditionally or even kind of on a safe level able to be cared for. And so I don't think that there's going to be this kind of watershed moment in which we're having to just completely turn away people from every hospital in London, or we're just having to blanket ban people coming into intensive care. But I think that it's kind of this insidious thing that's happening now and will continue to happen, in which we provide less and less kind of high quality intensive care or high dependency care to patients. And I think that we'd be we'd be lying to ourselves to say that that's not happening at the moment, and it's really it's a difficult thing to have to witness and work within. But it's the reality, and I suppose the silver lining is that those graphs in London are beginning to to plateau. We hope anyway, on only on a couple of days statistics, and so at least in A&E, after the next week, which will be incredibly busy because we know there's a delay and the lag of the most unwell people coming when they've actually contracted the virus, that we in the emergency department start to get a bit of respite. But the people who are on the wards or on intensive care will be there for much, much longer. And the system will it's going to take so much to try and and so long to try and get that system back to any degree of what we considered normal 9 months ago.
How are you on an emotional level, and how are your colleagues? I just, you've gone through such a year. You had the first wave, I imagine no real respite, and now you're in a wave which is even worse than the first. How are people holding up? Because that seems to be, the mental health of people working on the front line seems to be another thing which could quite easily be at breaking point, just like the NHS's ability to, give high quality care to everyone who turns up.
Yeah, I think it's really hard, and I think that personally, you try and decompress when you get back from work, and but I think the actual true emotional burden and toll it will have taken on me won't be apparent until until I'm able to rest, and I think that's a weird human coping mechanism, that you try and tunnel vision it until suddenly it all hits you, and I think that one of my colleagues and one of my good friends who works in acute medicine, another London hospital, messaged me yesterday or 2 days ago, after having what sounded like the shift from hell, and he said it's okay if I read out what he wrote, and I think that it's quite telling, and he's he would be one of the people who's would be the first to admit he's archetypally thick-skinned, doesn't would say doesn't take the emotional burden of a shift back home with him. But he sent me this after a shift in which 8 of his patients had died on a night shift, a 12-hour stretch. And he said, I had tears falling out of my eyes driving home after the shift, and I never get emotional. I'm fed up of telling people completely with it that they're dying and we can't do anything anymore. One man asked if he could take his mask off that night. He was failing on a CPAP, tight-fitting face mask. And I held his hand and he was gone so quickly. I hate calling the families. I hate it when they say thank you. I hate saying the same phrase over and over. I can't promise we're going to make you better. And that's not just a single voice. I'm hearing that echoed from lots of my friends and colleagues, and we're able to talk about these things. And I think that's part of the initial process of the grief and moral injury that this is creating. But the legacy of that is going to last lot past this wave, I think.
I want to just ask you about that. I know I need to let you go very soon so you can get to your night shift. But that concept of moral injury is something that I've heard a few times now, but might be a concept which many of our audience aren't aware of. Could you explain what you mean by that?
Yeah. So moral injury is a concept that comes from the psychology and psychiatric literature around mainly around PTSD, and so the experiencing traumatic experiences and the psychological ramifications that it might have, and the way that we process it. Humans often process things in slightly dysfunctional ways, and the way that it might affect the rest of their life is generally classed as a moral injury, and it's like any injury needs treatment. And that's where psychologists and people who are helping with behavioral therapy, psychiatrists, all of those will help people who are diagnosed with PTSD. And I think that we're going to see a lot of healthcare workers throughout, doctors, nurses, healthcare assistants, everyone who's just experienced these humongous volumes of grief and trauma in front of their very own eyes, will have to manage, and we'll have to have intensive treatment about.
Silas Webb, thank you so much for joining us this evening. We really do appreciate it, especially before you have what I imagine is going to be a very, very difficult night shift. All of our solidarity to you and your colleagues, who I think are really mopping up the mess of this government in a very honourable way. Silas Webb, thank you.
Cheers, pal. Thanks.
Dalia, I want to bring you in for some comment on what we've just heard, because I mean, my emotions when I listen to that, the situation that we've put people in, which they didn't sign up to do. If you sign up to be an NHS doctor, you don't expect to be in a situation where you might have to deny someone high quality care because there are too many people entering the hospital. You went into that job thinking, I don't know, I'm ventriloquizing a bit here, but what you're sold is you will be providing people with high quality care. Anyone who needs help can get help. You're not really trained in how to tell people that you can't have help because actually the hospital's full. So when I've heard this concept of moral injury discussed, which Silas articulated, so exceptionally there, it's often the emotional damage it causes to know that you aren't providing the service you want to be able to provide in someone's darkest hour. And the reason we are in this, I mean, there's a whole catalogue of failures we can list about this government, but most obviously, it's the fact that it was clear that cases were rising and rising and rising, and Boris Johnson didn't lock down until it was way too late, basically because he didn't want to stand up to sort of right-wing fanatics and his backbenchers. And he gets to stand up there at press conferences saying, oh, everything's going to be okay, I'm still jolly Boris Johnson, while you've got people essentially in a bit of a war zone in our hospitals across the country. I mean, what do you make of it? I mean, how do you have the same emotional response I do to this?
I mean, it's completely like harrowing and devastating to hear that. And obviously there is a key part here, which is the managing of these lockdowns, the managing of this pandemic, that all of the facts were all at the government's disposal. None of this is unforeseen in any way. And I think that with Boris Johnson, I don't think that this was just a political decision to let it get to this stage. I think it was ideological. I think that, the idea of supporting people to stay at home goes so up against his kind of like ideology of what Britain's working class should be doing, which is, working even if it's not safe for them to work, is kind of what drives him. And that, this kind of moral injury and the trauma and the harrowing scenes that we are seeing is a worthy price to pay to continue the economy in the most superficial way of idea of what that means. But we're also seeing the fruits of decades of underfunding and under-resourcing of the NHS coming into fruition. I have friends of mine who trained as sexual health nurses and who are now in high dependency units. That's not what they're trained to do. And that's high dependency units are one level below an ICU, so it's a very high stakes level of care. And when I look at the way that the Tories and the Tory media are kind of shifting that blame for what is happening onto people simply following the rules by going to work when their workplaces are still open, and how it's our duty to protect the NHS rather than the government's duty to ensure that we don't get to this kind of stage, it honestly just makes me feel so disgusted. And especially so many of those same politicians and journalists smeared junior doctors who went on strike in 2015 and 2016 to talk precisely about the fact that the new contracts that Jeremy Hunt was trying to introduce and the overall direction that the government was taking the NHS in was going to lead to collapse. And by collapse, we don't mean that one day you wake up and the NHS isn't there. It precisely means that that doctors and the healthcare infrastructure and nurses are so under-resourced and are so stretched and pushed that they can't provide that standard of care. That's what it means for the NHS to collapse. And a lot of the time, the fact that this has been able to continue has been politicians relying on the fact that doctors and nurses push themselves to their limits to save lives. We've all seen these really harrowing pictures of nurses with bruised faces from hours of wearing PPE. We've been hearing what Silas has been telling us about the trauma and the exhaustion that doctors and nurses are being faced with. And to exploit that is not only a moral outrage, it's not sustainable. You can't run a healthcare system like that, let alone in the middle of a pandemic. And the key thing here, and the key thing that I get from Silas speaking as well, is that health and care staff, they're not superheroes, they're not superhumans, they're human beings, and they just are not being treated like that right now by our government.
Yeah, I mean, it just feels so exploitative, doesn't it? Sort of using people's commitment to the job to make them go above and beyond what we'd expect of anyone else, and what we expect of our politicians, for example. I've got a couple of comments I want to go through. I saw lots of, solidarity to healthcare workers pop up on the screen. I'm just going to go to Regia D with 4.99, who says, please say a big thank you to all the wonderful NHS staff. Obviously, we'll say that on your behalf and all of our behalves at Novara Media. I'm sure everyone watching this show will have absolute solidarity with NHS workers right now. Also, a big super chat from Nils Potts with £50. Thank you very much. That will be, we do appreciate it. We have 1,600 people watching. Do share the show stream. Now, as we've been covering all week on this show, the Tories are intentionally stoking up resentment about people meeting socially, including outside and in parks, which is a relatively safe activity, to distract from their own catastrophic failures. This Thursday, the Home Office got in on the public shaming act. This is a fairly dystopian clip that went out from their official Twitter account.
Came from work, so I've just been chilling, then you're going to go home.
Yeah, you can't be chilling. Yeah, obviously, the reason we come to talk to you, we're in lockdown. You parked down the end of the street, looking a bit suspect. All right.
Just came from work, so I've just been chilling, then you're going to go home.
Yeah, you can't be chilling. You can leave home to go to work, you finish work, you go straight home. Okay, you can't hang out with your mates.
You're not hanging out, just
Mate, you're hanging out with your mates.
Yeah, but just been like 5-10 minutes.
Doesn't matter.
That's 5-10 minutes.
We're in lockdown. Another 1,300 people have died today. You need to get yourself straight home. All right. It's not up for you to argue about. Yeah, you can't be chilling.
So you can leave home to go to work, you finish work and you go straight home. Now, hearing that said by a cop as an order, let alone tweeted from the Home Office account, to me is truly dystopian. And that's obviously not to say that everyone should feel free to go hang out with their friends in cars. That's not a particularly safe activity, especially if the doors are closed. But it's no more risky, quite likely, quite possibly, than what he would have been doing at work, which not only does he have the choice to do, he's most likely pressured to do that. And having so many people going to work in this lockdown while social lives are so heavily policed doesn't just create risks in those workplaces, it also creates risks on public transport. We can take a look now at a scene which was tweeted yesterday by Tom Edwards, who's a journalist with BBC London. So it's people cramming on two trains at Canning Town. Apparently this was first thing in the morning. Now, the BBC journalist who tweeted it said, tube drivers getting increasingly concerned at number of travellers. This footage sent to me was Canning Town first thing. Now, I'd say they're not really travellers, are they? These aren't people who are going on holiday or going to meet friends. If it's first thing at Canning Town, these are people who are commuting. Apparently, also what I've heard is the first shift, if he's saying first thing, rush hour is apparently especially busy at sort of 5, 6, 7 a.m. because that's people going to construction sites, which are still running at full steam. Obviously, this inequality between the policing of businesses and the policing of people, I find very grating. It's probably not, though, the most disastrous aspect of the government's response to this pandemic. I want to show a brief clip from Newsnight this week. It concerns the policy announced by the government in September to offer those on benefits a £500 grant if they need to isolate for 2 weeks. Now, it turns out that even to receive that fairly modest amount, the vast majority of applications were rejected. So the clip I'll show you starts with the Director of Public Health in Calderdale explaining why 70% of people who claimed support to self-isolate in her region were rejected.
There's a number of reasons why people aren't eligible. They may not be on the qualifying benefits. They may not have the necessary evidence that they've been advised to self-isolate, or they may not be able to provide the evidence to the scheme to prove that their income is low enough, or that they don't have the savings that would disqualify them.
Introduced in late September, the upfront payment is administered by local authorities. The criteria is set by central government. People on low incomes who don't receive benefits are excluded, like one home carer in the northwest of England who got pinged by Test and Trace. She had to survive on statutory sick pay of £95 a week because she didn't qualify. She told us, "I struggled. It's frustrating that we're stuck in this position where you're feeling pretty helpless and like you're being penalised for doing the right thing. I haven't left the app on again," she said, "because I can't afford to be off work." Many want the support scheme widened.
Now, that is the most infuriating 60 seconds of TV I've seen, I think, since this lockdown started, or since this whole pandemic started. You know, that was someone who wanted to do the right thing. They had the app on, they got pinged, they asked for support so they could do the right thing, which is to stay home when you're supposed to. No support was offered, absolutely denied it. And so they did, you know, what's the rational thing to do? They deleted the app. They asked for support, they weren't given it, they can't afford to get pinged again. And not only is this completely unjust, it's completely self-defeating. How can we possibly control a virus when government policy is as defunct, as dysfunctional as this? Now, also it's worth noting she was a care worker, so precisely the person you don't want going to work with symptoms. I'm delighted now because to talk about the government failing in this respect, I'm joined by someone who's been one of the most consistent and powerful voices demanding the government take support of those self-isolating seriously. Susan Michie is Professor of Health Psychology and Director of Centre for Behaviour Change at UCL. She also sits on SPIB, which advises SAGE. Professor Susan Michie, welcome to the show. Thank you so much for joining us this evening.
My pleasure. Just to say that I'm here in my personal capacity.
Here in your personal capacity, of course. I am going to ask you some insight in terms of, I know it's relatively, you know, you're not supposed to say exactly who said what in a SAGE meeting, but I think probably you do have a bit more insight about how these decisions are made than I do or many of our audience. And my first question to you, because I know you've been such a strong advocate for, you know, people having proper support when they're self-isolating, why do you think this hasn't happened? You know, because the thing that frustrates me is this is so obvious. It's so obvious that we should have done this 10 months ago. And I mean, is there dissensus within sort of the scientific community, or is this purely the government are not listening to the scientific advice?
The Behavioural Science Advisory Committee I sit on, that advises SAGE, that in turn advises the government, has consistently been calling for more practical and financial support for people to isolate. If you look at other countries around the world that have managed the pandemic very well and back to, you know, not normal, but having a much more normal life than we have and much less harm to their economy, they have really paid attention to the whole test, trace and isolate system. And in terms of the isolation bit, other countries, and when I say other countries, I don't just mean Australia and New Zealand that are fairly wealthy countries, but countries all over the world. So, for example, Uruguay and Cuba in South America and the Caribbean, Kerala in India, we have Norway in Europe, where they really pay attention and will visit people every day when they're isolating. Different countries offer different things, but many offer practical support. You know, do you want help with getting provisions? Do you want help with putting a rubbish out? Also sometimes offering psychological and social support. Other countries also regard it as somebody's job to stay at home. You pay people to stay at home. So pay anything from 60% to 100% of people's salaries. I mean, £500 over 2 weeks is less than the minimum wage per hour. It's not enough for people to pay their bills, feed their families. And even when you look at countries like the United States, which hasn't in general managed the pandemic well. Obviously, it's very federal. It's very much based on each state's provision. But New York City, if either you have symptoms or you think you've been in touch with somebody who's been infected, you're offered free accommodation in a local hotel, free transport there and back, free meals during your stay, free internet. You can take your children in if you need to, even pet care. You know, which is a thing for some people. And countries throughout the world are offering accommodation where you can't isolate at home. So there's one issue which is about isolating away from the community, which means not going out to work, but that means not only having enough money to live, but it also means ensuring that you don't lose your job. But also there's the issue, which I haven't heard the UK government talk about at all, which is how do you isolate in your own home? Most of us have shared bathrooms, kitchens, etc. We don't live in houses that are big enough to isolate. Therefore, offering accommodation outside, which would be great for the hospitality industry, which is really struggling, hasn't, as far as I know, been seriously considered as an option.
So we started this section, or I started this section sort of talking about the different ways that social behaviour and sort of economic behaviour is policed in this lockdown, and how the government have been really heavy-handed in a way on people who are taking a walk with a friend and drinking a coffee, and very, the opposite, whatever the opposite of heavy-handed is, on businesses who are encouraging people to come into work. And obviously the lack of support means self-employed people have to go into work. From a sort of scientific perspective, could you give us an idea of sort of how important each of these different forms of, I mean, they're called non-pharmacological interventions, aren't they? So it's how important it is for people to not go for a long walk in a park and sit on a bench versus people who are going to work in estate agents. The various tools which the government could draw upon at this point. How would you sort of rank their importance?
Well, I think one has to go back to basics about how does this virus go from one person to another. There are 3 routes of transmission. One is droplets. So if I sneeze in your face and you're within 2 meters, you may get a droplet in your eyes, your nose, your mouth and become infected. The second is through touching surfaces that other people touch. So if you're infected, it's likely that your hands are infected, because we actually touch our eyes, nose or mouth, or our faces about 20 times an hour. Mainly we're not conscious of it, but this happens a lot. And so people are likely to have infected hands. They touch a surface that somebody else touches. That's the second route of transmission. The third, and this is one that we didn't know so much about at the beginning, is aerosol transmission. These are tiny, tiny droplets that don't fall to the ground. They're so tiny that they're sustained in the air for many hours, more than 12 hours often. And this has become seen as increasingly important route. And so one can really work it out for oneself where the really dangerous kind of situations. Anything that's enclosed is going to be dangerous. Therefore, if you're walking outside, walking side by side with a friend, there's next to no likelihood that you're going to get transmission from that. You're 20 times more likely to get infected indoors than outdoors. So big message is outdoors is relatively safe. When it comes to indoors, then ventilation is a big issue. If you have well-ventilated rooms, then yes, even if the aerosol is infected, it can be circulated out of there. The problem is a lot of businesses, whether they be shops, whether they be offices, whether they be cafes, whatever, if they're indoors, or a bus or a tube, any enclosed space like that, it just takes one infected person to be breathing out over a period of time, and it endangers absolutely everybody there. The other thing to think about is you're more likely to get infected the more people you see, the closer you stand to them, and the longer you are in contact with them. So you have to put all of these things into consideration. And then you just work out for each workplace, which is more dangerous. So for example, early years nurseries being kept open at the moment, I would say definitely super spreader events. You have people in enclosed spaces with each other over a long period of time in close proximity, touching the same surfaces, etc. And I know the argument, I think the government's been put forward is, well, a lot of these are private, therefore they may go bust. Well, the other side of this is the government has to support individuals, but also businesses to stay afloat over this period, because that's the only way in which we can get the economy back up and running as soon as it's safe to do so, and that we can look after people's livelihoods, which means their physical and mental health. In the long run, I mean, you and I, I'm sure, would think that the quality and the quantity of people's lives are important in themselves. But even if you don't think that about everybody, if you're interested in getting the economy back and running, then you look at countries throughout the world, and the World Bank, the International Monetary Fund, etc., have written reports on this. Those countries that locked down quickly and hard and built a functioning test, trace and isolate system are also those that not only have got on top of the pandemic well, and in many cases headed off a kind of really dangerous second wave, but also are those countries where the economies have been least harmed.
I'm glad you brought up aerosol transmission there, because this is something that, I mean, I've been finding very confusing in terms of government messaging, because I think, all of us understand that science changes. And, from the beginning of this pandemic to where we are now, we've learned a lot. And one of those things is we've learned that aerosol transmission is much more possible than we initially thought. And I think that's fine. We can all accept that. But what seems odd is that the government seemed to have very proactively tried to avoid recognition of that fact. We had hands, space, face, hands, face, space, and the space is the 2 meter distance. So there was nothing about ventilate. And the clip I want to show you is that at the Downing Street press conference today, everyone on the panel was asked about safety in workplaces and whether we should have more focus on that kind of thing. There were sort of sensible answers from the chief medical officer and the chief scientific officer. And then Boris Johnson sort of very pointedly intervened to say this.
I said it earlier on, I think it is very important for people not to just get fixated on exhalations, transmission by standing near somebody. Don't forget, it can also be transmitted, and it very likely is very commonly and widely transmitted by handling things and picking up something that's been touched by somebody who's infected. I think we forget that in the way that we're trying to restrict transmission. It's very important to remember that.
So what's strange about it? He says we forget that. We forget that you can get it from surfaces. But actually, all the polling shows the opposite. Everyone knows you should wash your hands. What people don't know is that it's transmitted by aerosols, because the government seem very unkeen, very unwilling to publicise that fact. Is that something that you'd agree with? Do you think the government have been very slow to respond to the possibility of aerosol transition? And I mean, I would say suspiciously slow to do so. I'm wondering what's going on.
It's not a question I thought about before, but I know scientific colleagues who know a lot about ventilation have said it should be face, space, whatever it is, I can't remember, and ventilate. The ventilation issue is really important. In thinking why that might be, I actually missed the press conference today, but why this emphasis might be, it may be that with hands, everybody can have an individual responsibility for keeping your hands sanitized. We can all use soap and water or have a sanitizer in our pocket if we haven't got access to soap and water. But ventilation, having safe workspaces that are ventilated, is not in our control. And I get many emails every week, increasingly so, from people who are, as they put it, being forced into unsafe working situations. And this is something that actually can only be solved by the government. And what we've seen is the government taking decisions, but then passing responsibility down to employers or individuals, blaming individuals for not doing the right thing. But so at the moment, it's up to employers, I think, to decide, are you an essential worker or not? It's up to employers to decide, is this a safe working space or not? I mean, we know from history, this is not a way in which we can responsibly and reliably do business, because it has to have health and safety inspectors, people who know what's required, have got systems for being able to check and validate and okay workplaces. So it may be that what he was doing was trying to make individuals feel more in control by keeping their hands clean, when actually what they're worried about is going into enclosed working places that the government are keeping open, which they didn't keep open in March. And what's very odd to me is that compared to March, we're in so much more of a serious situation. The transmission rates are much higher. we're in the winter, which means that it's cold weather. It means the virus will survive for much longer. It means we spend much longer indoors in our own homes, which again means more transmission, higher risk of transmission. We now have a variant that's become the dominant one that's 50% more infectious than in March. And we have an NHS that, quite frankly, is being overwhelmed. I think it's got beyond it's a possibility of it being overwhelmed. For all of those reasons, one would think that we should have more restrictions, not fewer restrictions than in March. But what do we have? We have fewer restrictions. It makes no sense to me.
In terms of that, so I mean, that was a position I've been very sympathetic to, and especially when we thought, this new variant was 70% more transmissible. So obviously we're going to need a harsher lockdown than in March. But what we have seen since this lockdown was introduced is that new cases have started to fall, not necessarily rapidly. We might want them to fall faster. But has that given you any second thoughts about the need to have a stricter lockdown? I imagine there are many people in government who are saying, look, the cases are falling. There's no pressure for us to make any rule changes now, either on business or social lives.
There's a lag between the cases, hospitalisation, intensive care, and if we're looking at what's going to happen in the hospitals and in terms of deaths, they're going to carry on rising, and we're in a situation where healthcare workers are absolutely on their knees. They're exhausted from this year. Many of them actually now facing anxiety, depression, post-traumatic stress disorder. People who are having trained to work looking after one patient in intensive care, because you'll have seen the pictures. There's so many machines. There's so much needs to happen. There's so much you need to keep an eye on all the time to look after one very, very sick patient. That same person who's been trained to look after one person is being asked to look after 4 people simultaneously, and people are dying on them. What kind of effect does one think that has on somebody? Really awful. And so just because cases are coming down, it is not a green light. The other thing, if you look back in March, they didn't come down quickly, they came down slowly. We need to get this plummeting. And the R level, the reproduction rate, is somewhere around 1.3, I think, at the moment. That has to be way below 1 to get this seriously coming down. So we're a long, long way out of the problem. And for every week that's delayed in terms of the maximum restrictions, it's unnecessary deaths. It's unnecessary people with long COVID. And we just don't know how long the long COVID is going on for. So when you're in a situation which is a crisis, it's an emergency that we're in at the moment, why wouldn't you do everything at your disposal? And we know that the one thing that we know we can do is keep people separated from each other. And the government's not doing that. They're only saying to us, it's mixed messages. It's actually contradictory messages. Stay at home, but actually you need to carry on going out to work. Otherwise, A, you may get sacked because we haven't said you're non-essential. And B, if you don't work because you're self-employed, then we're not going to pay you to support you. And so you'll starve. So it's putting people in impossible situations. And I think what we've seen over this year is problems with the government dithering and delaying at huge cost in lives, and giving these mixed messages at huge costs in lives, and going half-hearted. And that's the worst for everything. It's worst for people in terms of their sense of control, their certainty. It's worse for the health service. It's worse for people's lives. And it's worse for the economy. What the economy needs to do, or what businesses need to do, is have certainty, have a strategy. We still have not got any strategy after all this time. We need a strategy. And I sit on Independent Sage also, and the strategy has been right from the beginning, and we've got excellent reports on it. I commend your viewers to go onto our website and look at some of these reports about zero COVID. This is what countries have successfully done all the way around the world, is you drive down the transmission levels to such a low level that you can then manage outbreaks. There will inevitably be some outbreaks, but you have a very good test, trace, and isolate system. So when there's an outbreak, you jump on it early, you contain it, as China is doing at the moment. You know, they have very few deaths, but when they have an outbreak, if it may be just a few tens of people or a couple of hundred people, they'll lock down millions and millions and millions of people and have a very effective test, trace, and isolate system for a very short time. And then it's contained and they're able to open up again. We wasted the summer. You know, we did exactly what we shouldn't have done. We said, go abroad in your travel corridors, eat out to help out, go out and enjoy the summer. At one point, go back to work, or you might lose your job. You know, all of these things, which was the absolute opposite of what should have happened. We should have used that summer to drive it down towards zero COVID, use the summer to have learnt the lessons that these big privatized companies don't have the experience or expertise to do effective test, trace, and isolate system, whereas our local public health, based on our local authorities, coordinated with primary care and the NHS, have shown that when they've done this, they've done it extremely well. The resources should have been put there and built up a good test, trace, and isolate system. If we'd done all of that, we wouldn't have been in the second wave. We could have avoided all these unnecessary deaths. And I would say it's still not too late, because we have to be looking now is we don't want a third wave. We don't want a third lockdown. We want to learn the lessons from our own mistakes in the past and learn the lessons from what's worked in the rest of the world and do things differently. And just everybody in whatever situation they're in, I hope will be able to really put pressure on the government, because it's obvious the government aren't going to do this without a lot of pressure.
Professor Susan Michie, thank you so much for finding time to give us your experience and expertise this evening. I think our audience, their only regrets will be that, you know, the government hasn't listened to Independent Sage and SBIB as much as it probably should have done. So thank you for joining us this evening.
My pleasure. Thank you.
There is one more story which is very much related that I want to go straight onto, which again is about sort of the government's failure to support people during, this is especially during lockdowns. And this one concerns in particular the struggle of working mums to get furloughed if they request time off to supervise their kids when schools are closed. So the research was done by the TUC. It was written up in the Mirror. I'm going to go to a couple of quotes now. So there are a TUC survey of more than 50,000 women found that 71% of those who asked following school closures were turned down. Huge numbers of working parents, 2 in 5 of the total, did not realise they have been entitled to request furlough since March. Later, the article says almost half of respondents to the survey fear they will be treated negatively by their employers because of difficulties with childcare. Thousands of women across the country have been forced to reduce their hours at work, take unpaid leave or holiday to cope, or leave their jobs altogether. Now, Dada, I want to bring you in to get your comment on this one. I mean, I find this so infuriating, especially when we've had a government which has, you know, talked so much about how much it cares about kids' developments and kids' education. Obviously, here again, you've got lots of people who want to do something quite noble, really, which is take time out of work to look after their kids who aren't able to go into school anymore. And again, well, now it's their employers saying, no, sorry, you can't do that very noble thing, and the government not backing them up. And I suppose the thing that infuriates me so much about this is that this is Rishi Sunak's responsibility, and he's still the most popular politician in the country.
I mean,
make sense to me.
Yeah, I mean, on the one hand, it beggars belief. Like, I don't think the government could actually be doing worse if it tried. Like, not only are we seeing an unacceptable scale of death and infection that can be directly connected to policy decisions in a way that Professor Michie outlined so perfectly. And, you know, we have more deaths here, I think, than the US per capita. So, but we're also seeing a government that is absolutely hell-bent on taking absolutely no responsibility for it, as we can see in this ongoing effort to kind of blame individuals who are actually doing very low-risk behavior while continuing to encourage very high risk behavior and putting people in positions where they have no choice but to undergo high risk behavior. And it absolutely floors me that a government, that this government is not hugely unpopular for that reason, for both the failures and the refusal to take accountability and the refusal to learn lessons and the demonizing of the public at the end of all of that. But on the other hand, it's quite easy to explain. We have a hugely corrupt media system, and it's important to call it that. People use words like chumocracy. No, it's old-fashioned corruption. Newspaper and broadcast media, which is still sort of the primary way that a lot of people get their information and make sense of events that are unfolding, is filled with journalists who are often just a few personal degrees away from, removed from politicians who are making these terrible decisions. They're engaging in essentially a kind of a client journalism, and that was so epitomized by the career trajectory of someone like Allegra Stratton, who went from being a BBC journalist to being the literal spokesperson for Downing Street, because apparently in 2021 there's a lot of transferable skills between those two roles. So that's why we see things like, in its most crass form, we see pictures of Rishi Sunak drawn like he's a superhero when he was undergoing a policy, the Eat Out to Help Out policy, that is probably why we're in the hellfire that we're in now. But also the fact that, the media just sort of out of nowhere decided to stop reporting daily infection and death rates for a really long time because it made the government look bad. I have to go to the New York Times to get good data journalism on, how on COVID in Britain. So even if people sort of are looking at their own conditions and they are thinking, something's really gone wrong here, something really isn't right here, they are essentially gaslit consistently by the media class. And, it's also down to the fact that the so-called opposition party is articulating no opposition whatsoever. The strategy of Starmer's Labour Party is essentially to agree with the broad ideology and policy decisions being made by the Tories, but just saying that the Tories aren't carrying it out, competently or effectively enough or efficiently enough, rather than sort of pointing out that the policies themselves are the problem. So, that leaves people with a sense of, well, if, the media isn't saying anything and the opposition party isn't saying anything, then yeah, stuff is really awful. But there's no other options because there isn't another way of doing things. So I think on the one hand, when you look at it, you think, how on earth could, and sometimes I'm just like, I don't understand English people. And because I think this is a really English thing. I'm sure if you polled the Scots, and the Welsh independently, they would be a lot more oppositional to what the Tory government is doing. But when you actually think about it, you think about the lack of substantive, healthy, oppositional political culture, both in the form of the media and in the form of the opposition, it makes perfect sense. People can't imagine a way of things being any different.
We can ask our next guest if Scots really are more oppositional towards Tory government policy when it comes to COVID-19. For now, we have 2,000 people watching, only 500 likes. Do like the video. It helps us in the algorithm, means more people see the show. I'm going to go to a couple of comments. Simon Dwayne tweets on the hashtag Tysky Sour. We have failed to save the NHS. It has actually slipped off the edge of the cliff. Huge numbers of NHS staff face serious PTSD for a long time after this is all over. Save the NHS no longer cuts it as a slogan. Ollie SH on Twitch chat says, currently working in an LFT testing centre, and honestly, it's a constant waking paranoid nightmare. Cannot imagine how ICU nurses are feeling. Wow, yeah. So that's a lateral flow testing centre. So even people who are working on the testing front line, that's stressful enough. So imagine when you've got people where it's life and death everywhere where you are. Chris Wellbook with $9.99, worked in a school during all lockdown. Huge difference between now and March. I drove down the M1 with no other cars. Now streets are filled at 7 and 5. Clearly people commuting to and from work. I think that concurs with many people's experience. Rush hour is very different to how it was in the first lockdown, and especially people working in schools. Schools are very, very different to they were in the first lockdown. Back then, I think you often had sort of 3 people in a class turning up. Now it's about 10 people turning up in a class. So even if we have reached a point where infections are going down, that probably won't happen particularly quickly. Let's go straight on to our next story. One of the big electoral events of this year will be May's elections to Holyrood, the Scottish Parliament. That race was put into flux when on Thursday night, Labour's leader in Scotland and candidate to be First Minister, Richard Leonard, resigned. He explained his decision to BBC Scotland.
My leadership was still the subject of speculation, and we are about to fight one of the most important elections in the history of the devolution era. And so I think the distraction that speculation about my leadership was causing was harming Labour's chances of getting our message across in those important elections. And so I took the very difficult decision that the best thing that I could do for me and in the interest of the party was to step down. The Scottish Labour Party, like the whole of the Labour Party, is a broad church. It brings together different perspectives and views on the left, but we are at our best when we are pulling together. No party is well served by disunity, especially in the lead up to an election. And you know, one of the reasons why I've made the decision that now is the time for me to go is because I want to see a united party.
You sound, Richard Leonard sounding very magnanimous there, but there have also been some more controversial reports that his resignation might have been at the behest of Labour Party donors. To talk about this story, to talk about both angles, what's going on here, I'm delighted to be joined by Neil Findlay, who is a member of the Scottish Parliament, who backed Richard Leonard to become leader of Scottish Labour. Neil, thank you so much for joining
No problem, Michael.
This evening. Can I get you by, explaining your interpretation of what's happened? Richard Leonard there sort of saying he's willingly resigned, but also hinting the only reason he's resigned is because there was going to be speculation about him resigning. Is this a case of him deciding it's time to step down, or was he pushed?
Well, there's been a war of attrition against Richard Leonard's leadership from day one. And let me say, Richard Leonard made many, many, many mistakes. He made probably every mistake that Jeremy made and some. And the biggest mistake was trying to appease people who would never have been appeased because they were the defeated, they were the self-entitled, they were the people who think that they have a God-given right to run the Labour Party, and we saw that at Westminster as well with the coups against Jeremy Corbyn, and we've seen it up here. They've been running a war of attrition against Richard's leadership since before he was elected. When it looked as though he was going to be elected, they started then, and they've never let up to the point where we're only a small group in Parliament. There's only 24 members, unlike the PLP where you've got a couple of hundred members. But we couldn't go into a room of 24 people and have a private conversation without that conversation being leaked to the media before we had even left the room. And that went on and on and on and on. And every opportunity they had to undermine him, to attack him, to undermine anyone associated with him, they took that opportunity. And even some of them had employed a journalist who was a part-time worker for them, but also in his spare time, he wrote articles for Scottish newspapers attacking the Labour Party, and yet he was employed by a Labour MSP. So this is the culmination of a 3-year war of attrition. And I suppose some of them will be sitting back like when the US forces got Saddam and saying, "We got him."
Do you sense that is the mood among many of your peers, many other MSPs who are now sort of delighted that they've got what they've wanted for a long time, which is for Richard Leonard to stand down?
Yeah, there's good people in that group and people who I hugely respect. But there's a group of people who, frankly, their behaviour is absolutely appalling behaviour. In any other workplace, they would have been sacked a long time ago for treachery. Some of the stuff that they have done, if that was done in a workplace, it would be instant dismissal for what you did. But their behaviour has been extraordinarily awful. And by the way, some of them have a history of it going back 20 years. And if you went and asked any leader of the Labour Party in Scotland, they'll tell you the same people were behind the briefings and the speculation about them. So it's a lifelong crusade for some.
And what's your analysis of, I mean, what Scottish Labour can do? Because I mean, I don't want to sound harsh, but it seems almost a bit like a lost cause at the moment. It's difficult to see how the party north of the border is going to get its mojo back. I want to bring up very quickly just a forecast from Britain Elect. So this is for the upcoming elections to Holyrood. They are projecting that the SNP will get 72 MSPs, which is 9 more than in 2016. The Conservatives will get 24, which is 7 less than in 2016, and Labour will be down to 19. And it looks from where many people are standing that, I mean, how do you rescue that, especially when it seems that lots of traditional Labour voters do feel quite well represented by the SNP? I mean, what is the way back?
I was listening to your previous conversation about how dreadful the Tories' handling of COVID is, and there's this impression, and it's quite a frustration amongst the Scottish left about how the English left views the SNP and views Nicola Sturgeon. I mean, you really have to open your eyes to what is going on in Scotland. The fact that she is a more capable communicator than Boris Johnson is not a high bar, I have to say, but she can communicate very well. She's a very capable politician. But Scotland's record on COVID is appalling. We've got almost, the same levels of deaths as we have in England. We have a worse care home crisis than we have. Lots of the indicators are as bad, if not worse, than in England and Wales. So this idea that Scotland is somehow performing well in COVID is just does not bear any out with reality. The issue for me, and the issue that I have pleaded with UK leaders, I've pleaded with Scottish leaders to address, is the biggest issue that dominates the entire political discourse in Scotland, and that is the Constitution. And we do not have a credible constitutional position, and that is the fundamental problem that Labour has. I don't want to see Scotland going down the road of independence. I want us to have maximum devolution, so that we work on the principle that we devolve all powers to Scotland unless there's an overwhelming reason not to devolve those powers. And let me give you a couple of examples. Scotland has the worst drug deaths rate in the developed world. We have 3 times the rate of drug deaths than you have in England, which is an extraordinarily appalling situation. So why would we not devolve all powers over drugs to Scotland to address our problems here? So that to me is an obvious one. But let me take the example of, say, the border. Why would we, on a tiny or a relatively small island nation, create an internal border within that country? That to me does not make sense. That doesn't mean that you can have flexibility within the immigration system. We can, but why would you devolve the border in a small island nation and border control and all of that? So these are just 2 examples. We could go through all the policy areas, and I could make an argument for them either being devolved or UK held. And that's the position I believe we should be in. And we should be advocating that positively and vigorously, instead of saying no to a referendum. If the people want a referendum, so be it. So be it. You cannot stop democracy. If that's what people want, we should be engaging positively in that.
And finally, can I get you to, I don't know if you're a betting man, but if you were, what do you see as the most likely, next step for Scottish Labour? It seems to me there is, probably the favourites to take over now are people who are towards the right of the party, who want to double down on a unionist strategy, which is obviously what Keir Starmer is doing from Westminster. So do you see that basically it's almost inevitable now that there's going to be a return to that fairly, right-wing basically version of Scottish Labour that we saw before Richard Leonard? Or do you think there is a chance for sort of the left of the Scottish party to still sort of make an attempt to get the leadership, or at least have some influence in the party going forward?
If they take a hard unionist position, then I think it is. I think they're heading for the iceberg. It'll be the whoever leads the Labour Party will be the conductor of the orchestra on the Titanic, because I think that's a disastrous position. When I was in the shadow cabinet up here, and we were taking some advice from pollsters, they were telling us that we were, I think it was something like 3 or 4 times more likely to attract back working class voters who were yes voters in the referendum, who had gone over from Labour to the SNP. We were 4 times more likely to get them back than we were people who had gone from the Labour Party to the Tory Party because of the independence issue. And yet those who I think will seek to lead the party believe that our future is more rosy if we will go after those Tory voters who have gone from Labour. I think that is lunacy and it's delusion.
Neil Findlay, thank you so much for finding the time to talk to us this evening.
Thank you, Michael. Bye now.
At this point, I'm going to do something novel, which is I need to hand over to Dahlia, who I'm going to get Fox to send over some comments from the chat, because I've done the stupid thing of not remembering to plug in my laptop. So I'm going to do that. Hopefully, Fox, you can cut to Dahlia and she can hold the fort. Perfect. I'm going to vacate my chair.
Hi. So, yeah, I mean, well, and to go back on that last sort of commentary that we had there, and I've said this many times on the show before, that this move is completely in keeping with the kind of model of the Labour Party that Keir Starmer is trying to rebuild, even if it doesn't make any electoral sense, as was just pointed out. And it's a model that essentially depletes the power of the membership, that pivots its funding model and therefore the people it's accountable to away from workers, from trade unions, and towards private finance from wealthy individual donors, people who are often not from the same class position as the Labour Party is supposed to represent, but also who are not transparent and unaccountable, and who are unaccountable. Say what you want about the union leadership. There's actually, at least the union leadership can say, well, I was elected in by my due-paying members. Whereas we don't really know who these private donors are, and these sort of behind-the-scenes conversations that are being had and are having huge impact on the political direction that's being taken by the party. And that's not just an organizational shift, that is a distinctly political one. And we are seeing its impact in a decision like this one, where private donors were able to hand select the members who is going to kind of represent the Scottish Labour Party. But I don't know much about Richard Leonard, but I can't imagine that it's going to do that much good for the Scottish Labour Party to have a very England-centric Labour Party kind of intervening top down in the affairs of the Scottish Labour Party in this way. And I'm sure it will turn a lot more Scots to the SNP and towards Scottish independence in general. So it's politically bad and it's strategically bad, and it is the outcome of the organisational shift that is happening under Starmer in the Labour Party.
I'm going to read some comments before we go to our next story. Alison Oliver with $4.99 says, have to send another super chat for the excellent Susan Michie. She should be broadcast into every UK home. I couldn't agree more. She should also, have a permanent spot in Downing Street, I think, so she can harangue Boris Johnson to make more sensible and less deadly decisions. Soapbox Jewelry tweets on the hashtag Tysky Sour. Listening to Silas on Tysky Sour made me realise that when this is all over, whatever that means, the government will treat NHS staff like they treat war veterans. They'll call them heroes and then abandon them with PTSD. Wow, that's a really powerful and I suppose tragic comment, really, but it's difficult to disagree with. I suppose, these are political battles. We can try and make sure the government are unable to do that, even if that is what they will be inclined to do. Our next story. A ruling by the press watchdog Ipso has found an article by Toby Young in the Daily Telegraph to be, and I quote, significantly misleading. They've ordered the paper to publish a correction. Now, the piece is no longer available on the Telegraph website, but the headline did read when it was up, "When we have herd immunity, Boris will face a reckoning on this pointless and damaging lockdown." Now, for context, that piece was published on July the 11th, just as we were coming out of the first lockdown. Now, obviously, Toby Young doesn't write the headlines, the Telegraph do, but here's what he did write in the piece. So these are his words from his mouth or from his laptop or whatever. He writes, "Some will have developed antibodies without knowing they had the disease, while others will have a natural immunity because they've already successfully fought off other coronaviruses, such as the common cold." Now, if this sounds ridiculous, that's because it is. Obviously, we didn't all have herd immunity because so many of us had had colds before. We're bang in the middle of a very, very deadly second wave, which people like Toby Young thought would be impossible. Now, Young argued that people in this category will be immune even if they don't test positive for COVID antibodies. And the Daily Telegraph argued to Ipso that this was in reference to cross-reactive T cells. They're trying to sort of post facto cover their back, say, oh, no, this did make sense. Now, the claimant, the person who complained to Ipso, is a man named James Whitehead. He said that T cells may lessen the impact of COVID-19, but wouldn't stop infection entirely, so would not contribute to herd immunity, as the article suggested. But Ipso, in their ruling, highlighted the columnist had at no point referred to T cells, made any effort to explain their relationship to COVID-19 immunity, or even distinguished between the commonly understood definition of immunity and the emerging science of T cell immunity. It could not therefore claim that this amounted to immunity. The publication had therefore failed to take care not to publish inaccurate and misleading information in breach of Clause 1. Now, Clause 1 in the Ipso code is in reference to accuracy. And they found the statement was significantly misleading. It misrepresented the nature of immunity and implied that people previously exposed to some common cold might be automatically immune to suffering symptoms and passing on COVID-19 to others. So you can see there he's saying we'll all be immune because of T cells. They're saying well, you didn't reference T cells. What you have claimed there was inaccurate and you had no justification to say it. Very, very strong ruling there from Ipso. And this wasn't the only inaccuracy they dealt with. So Young also wrote that because of the supposed presence of the T cells, London is probably approaching herd immunity, even though only 17% tested positive for antibodies in the most recent seroprevalence survey. When challenged on this, the Telegraph decided to refer to an article on lockdown.skeptics.org, which is Toby Young's own website. Not exactly an independent source of expertise. And even then, this is what Ipso made of it. So they write, the article suggested that according to two scientific studies, only 15 to 25% of the population being infected and becoming properly immune is sufficient to stop the virus spreading, which the newspaper said had happened in London. However, the two studies ultimately relied on did not conclude that London specifically or the UK was probably approaching herd immunity. They go on. The statement that cross-reactive T cells mean that the population of London is probably approaching herd immunity was significantly misleading. It was misleading both as to how herd immunity is reached and whether it existed in London, and the inaccuracy had been relied on to support the article's other arguments, such as the claims that we can dispense with pointless social distancing measures and that lockdown has done nothing. Ipso noted in reference to both of these breaches that the Telegraph had never offered to publish a correction since the article was published, so they had to be forced, essentially. We should also remind ourselves that Young concluded the article by saying, a second wave of COVID is unlikely. Dalia, I know you're no fan of Toby Young, but this is pretty damning from Ipso, isn't it? And I suppose my question for you is do you think we might be seeing a bit of a tipping point now? I mean, obviously, it's almost too late to have this tipping point. Now that we're in a deadly second wave, finally, there is some accountability for those people who said it would be impossible. But this ruling could potentially make people like the Telegraph feel a bit more reluctant to publish quack science on this, which, by the way, we know has been very influential during this pandemic. We know that one of the reasons why Boris Johnson has been so slow to enter things like lockdowns is because he has been listening to basically very fringe scientists and the kind of commentators who write on the comment pages of The Spectator and The Telegraph. Dalia, what do you reckon? Have we reached a tipping point?
I mean, I think it's unlikely. I think that what might instead happen, I mean, first of all, I think the Telegraph and other outlets that platform this kind of nonsense, and we saw BBC Question Time doing something very similar with Julia Hartley-Brewer not that long ago. They probably just sort of factor it into their expense cost, that, you know, this is what they're going to have to kind of deal with. But, you know, I think what might happen is that, you know, they might sort of change tack a little bit, and rather than sort of saying that lockdowns are not effective, considering that it's very difficult to argue that. It's also difficult, and Toby Young was making those arguments, and yet he somehow found a way to do so. What they might do is they might change tack to their good old sort of eugenicsy argument, which is, and we're seeing this happen more and more, which is this idea that the rates of death are very low amongst people who are under 60 and who don't have underlying conditions, and therefore people who are above 60 or do have underlying conditions are essentially already dead. So it doesn't matter if we let a virus and we don't let a virus move through the population and kill those people. You know, and it comes from kind of that innate disgust that these people have at the idea of making any kind of sacrifice for someone that they perceive to be weaker or more vulnerable than them. Although this is a man who gains his sense of masculinity from wearing a mask, from not wearing a mask, and you know so I think that, you know, some of that kind of stuff might become more popular, and we're kind of seeing them change tack a little bit, of rather than trying to be kind of pound shop epidemiologists, of actually just going, you know, being kind of more honest with what their position is, which is that I don't care about anyone who I don't deem to be fit and healthy, and, you know, who, if someone has an underlying condition or if someone is over 60, then that's their own fault. I should be allowed to go to the pub as I please. And, you know, I feel so sorry for scientists and epidemiologists who are having their expertise and their qualifications essentially insulted by having to go toe to toe and answer directly to these kind of people, to people like Toby Young, as if they're equal opponents in this debate. And I cringe watching, you know, epidemiologists at the top of their field having to talk to Dan Wootton and people like that about, you know, in the middle of a pandemic. It's frankly insulting, and it's not good journalism. It's not good production. It's not good broadcast media. It's not responsible. And especially after, you know, how we open this show with that interview with Silas. And it's just enraging to hear him sort of talking about that trauma and, you know, that lifelong trauma, that exhaustion, and the scale of death that is happening from, you know, around him and his colleagues. And then hear Toby Young getting paid significantly more than someone like Silas is getting paid to spread this shit from the comfort of his own, I presume, several homes. I mean, where are we? That this is what is being, that this is the decision that producers and editors are being made, and that these are the voices that are empowered in our society above the people who are actually on the front line. Something's gone very, very wrong. And honestly, you know, when I first read this story and I first read those tweets, I found it funny. But after hearing, you know, Silas talking about what he's going through as a consequence of the, unfortunately, the impact, which is significant, of this kind of shit stirring, it's enraging. It's not funny. It's enraging.
Mm-hmm. I mean, I totally agree. I mean, because I think it is important to hold people accountable for what they've said in the past, especially on an issue as significant and impactful as this, consequential as this one. We're going to go through sort of Toby Young's history on these topics. Before that, if you are enjoying the show, do subscribe to the channel. We go live every Monday, Wednesday, and Friday at 7 p.m. Now, Toby Young has apparently managed to reflect on his judgment and published statements from the time when The Guardian reporting that Young, one of the most prominent critics of lockdowns as a response to the pandemic, admitted last week that he had got that wrong when he wrote last June that the virus has all but disappeared. But despite the fact he has recognised he was wrong, he has continued to argue strongly against lockdowns, and on Wednesday called news coverage of the growing death toll from the virus hysterical. Now, of course, the Telegraph carried on the summer, not by thinking that they should stop publishing Toby Young, but continuing. So these are some of the claims that haven't stood the test of time. So this is from the 12th of August 2020. So Toby Young writes, the check-in process at Heathrow took at least 4 times longer than usual, and having to wear a face nappy for the entire journey was a pain in the bum. But in Venice, things started to look up. I'd finally escaped Gulag Britain. What a little baby he is. The next one is from 18th of April 2020. I'll go to you after this one, Dahlia. What happened to British people's bulldog spirit, our instinctive libertarianism? It's tempting to think that the feminization of British culture has left us bereft of manly virtues. We used to become men without chests, to use C.S. Lewis's phrase. So this is, I presume, in reference to how willing we all are to comply with lockdown measures. Do you, well, I'm sure you don't agree, but, or maybe you do agree. Is it actually a victory of feminism that this country was so willing to accept the very reasonable lockdown rules which were imposed upon us?
I mean, I don't think it has anything to do with that. I mean, this man has to be a troll at this point. And I also like the fact that, you know, he calls it a face nappy, because it's an admission that he primarily spews shit from his mouth, because that is basically all he exists to do. He's a paid up troll, essentially. And he also has this, you know, discovered really early on that this kind of, you know, at a time when, you know, newspapers and broadcast media is not able to finance actually good critical investigative journalism, but is instead relying on kind of clickbait, shock jock style journalism that goes really viral. I mean, journalism that goes really viral. He's clocked that it makes a quick buck for him, I guess. Yeah, it's appalling, and shame on any editor that let that pass their desk.
And I mean, he was doing the work. I mean, the worst thing people have sort of maintained throughout this whole crisis is that essentially COVID-19 is just like the flu, something you heard from Bolsonaro, something the most irresponsible leaders around the world have been parroting. And also that got printed in the Telegraph. This is from the 29th of May. Toby Young writes, and even if you catch the disease, it may not be much more deadly than a bad bout of seasonal influenza. We should dispense with silly, overcautious social distancing rules. Let's just get back to the way things were. Now, here he is essentially suggesting the Conservative government should just let COVID speed up the process of killing the elderly. So this is next. Even if we accept the statistical modelling of Dr. Neil Ferguson's team, which I'll come to in a minute, spending £350 billion to prolong the lives of a few 100,000, mostly elderly people, is an irresponsible use of taxpayers' money. So that was written in The Critic on the 31st of March 2020. Now that's quite explicit there, isn't he? He's saying the quiet part out loud. He's saying, is it really worth spending all this money to save the lives of some old people?
I mean, surely that's the definition of a responsible use of taxpayers' money. I'm sure he thinks a much more responsible use of taxpayers' money is to pay government mates to give, to spend, £5 on half a bloody carrot and a third of a red pepper, and pocket the other 25 quid for whatever it is they get up to in their spare time. Like, surely that's why we pay our taxes. Is it not?
I mean, yeah, I think if money saves lives, it's probably money well spent. Now, these are obviously just a handful of statements from Toby Young. There are plenty more. Anyone who says, why are you going through past statements? Anyone's free to go through my past statements and see whether they stood the test of time. Presumably, lots of them don't. But I don't think any of them were quite as irresponsible and with such terrible consequences as the COVID deniers who have been actively pressuring the government basically to adopt deadly policies, which sadly they so often did. We're going to go on to our final story. Before we do that, please do like the video. It helps us on the algorithm. Our final story. How's Brexit going? Now, normally when we've asked that question, we've been referring to negotiations in Brussels, parliamentary wrangling in Westminster, or the illusory prospect of no deal. But now it's been 2 weeks since we actually left the European Union, so the consequences can finally be felt on the ground. This is real now. So what do Brexit's backers think? What do Brexit's backers think has changed for the better? This is Jacob Rees-Mogg in the House of Commons.
The key is we've got our fish back. They're now British fish, and they're better and happier fish for it.
Obviously, there's overwhelming evidence for that. Let's enter Mansfield with.
Now, this is the issue that has dominated politics for 5 years. Literally, how many times have we had to speak on Tysky Sour about the wrangling over Brexit, this issue that has torn the country apart, which has toppled prime ministers? And now we've got one of its most high-profile backers and a government minister citing in Parliament as a benefit of Brexit, happy fish. Now, this would be just cringe comedy. You know, we expect this kind of thing from Jacob Rees-Mogg, but it is actually quite tragic. That's because whilst fish might be happier, I mean, they're not, but while the joke is that fish might be happier, we know that fishermen aren't. This is a clip from Thursdays at BBC News at 6.
It's a prime product which usually commands premium prices in Europe. Live seafood needs to get to market fresh, and that means fast. But for the last 2 weeks, there's been new layers of Brexit red tape, paperwork and additional checks, which has led to disruption and delays and warnings that some businesses could go bust.
Tens of thousands of pounds a week that we're losing. We can't continue to lose that. We sent stuff to Europe last week. It took 5 days to arrive. It arrived dead and rotten. We lost that product. So we're into the second week now and we can't sail to our biggest market, which is EU.
And it means some fishing vessels are choosing to stay in port.
So while we've got, the Conservative government and the people who are most responsible for the kind of Brexit we've had, which is a fairly hard one, there are now lots and lots of regulatory borders in between the UK and Europe, or Great Britain and the rest of Europe, because obviously Northern Ireland actually has fewer regulatory borders now. While they're making jokes in Parliament about all of this, the people who this is actually affected are losing shed loads of money. Their businesses are at threat. Their livelihoods are at risk. And my question for you, Dahlia, is specifically, I know you're not an expert on fish, so I want this from the political angle, but me watching that clip on the BBC News yesterday, what it made me think is, have the government made a real error by making fish the big issue of Brexit? We were all, they sort of encouraged us all to care about fish. I hadn't thought about fish much in my life, I have to admit. But they were saying, this really matters. It really matters if we control our waters. You should care about the politics of fish. And now, 2 weeks into Brexit, all of the country's fishermen have products which are basically rotting in storage facilities because they can't get them to their customers in time. So is this something that's going to come to bite them in the arse?
Well, I think the way that they probably rationalized it was that, Brexit is this hugely controversial thing, right? No, hugely complex thing. I mean, it's also controversial, but complex thing. And if we can make it about one little thing, if we can make it about the fish, then all we have to do is win the fish, and then we've won the whole thing. And I think there's also, and this is perhaps a little bit kind of the English lit student in me kind of coming out, but like this kind of sense as well of like the idea of sovereignty and the relationship between sovereignty and like the sea, and this idea of having control of the sea is like kind of part of that imagination of sovereignty when you are an island. What I'm confused about is how, given that they made this strategy to basically, like I said, make it about the fish so that all you have to do is win the fish, I'm very shocked that they didn't put more work, like more, of their Donald Trump, Boris Johnson's alleged deal-making abilities to winning the fish, given that that's what their strategy relied on. But also, I think what the big political fallout will be is likely, again, and it's come up multiple times this show, and it's come up a lot in Tysky actually over the past few months, which I think is again saying a big thing about where we're heading, is I think it's again going to cause huge fissures between Scotland and the rest of the union, because a lot of the impact here is being felt by Scottish fishermen. They command a lot of the UK market. They command a lot of the fisheries are in Scotland. I think something like 60% of the UK fisheries are in Scotland. And Scotland didn't vote for Brexit, so again, it feels like England is deciding the future, making huge decisions for the political future of Scotland. And so all this is going to do is again make Scottish independence and the fight for Scottish independence even more inevitable. And the irony of that was that, you know, a lot of Brexit was done on this kind of colonial sort of idea of, you know, this strong Britain that is able to kind of relive its old imperial past, when it looks like that decision is actually going to break that very union down. So I think that that's likely to be a really strong political outcome. I'm not sure if it's necessarily going to change the minds of a lot of people who voted Brexit, because I think that a lot of that was about immigration and about race politics, as well as kind of other things. But I think what it will do is it's going to be, if the SNP can mobilise that, it's going to be very, very powerful in Scottish politics.
Fishery-based fishers is maybe going to be, you know, the big political issue we didn't expect to arise in 2021. Now, we've also got some worrying news about how Brexit might affect those of us who live primarily or work primarily on dry land. The FT reported today that the government are planning a post-Brexit overhaul of UK labour rights, which would include workers' protections previously enshrined in EU law. Now, the report suggests this includes the 48-hour week. The package, this is from the FT, the package of deregulatory measures is being put together by the UK's Business Department with the approval of Downing Street, according to people familiar with the matter. It has not yet been agreed by ministers or put to the cabinet, but select business leaders have been sounding out the plan. The proposed shake-up of regulations from the Working Time Directive will delight many Tory MPs, but this is likely to spark outrage among Britain's trade union leaders. Now, Dahlia, a final point to you. I mean, ministers have said they have no plans to dilute workers' rights, but as that FT report suggests, you've got two groups of people in Boris Johnson's ears. One of them is right-wing Tory backbenchers, and the other is the trade unions. And we know which side Boris Johnson tends to give priority to.
Yeah, I mean, look, we always knew that this was what a Tory Brexit was going to look like, and I wish that this had been the story rather than fisheries. And you know what really worries me here as well is that it's going to massively increase the bargaining power of massive corporations who will be able to say, you know, you're on the back foot here. If you want us to set up a factory here and not in Amsterdam or in Berlin, where we can have freer access to the European markets, then you have to accept whatever wages and conditions that we set out for you. You don't really have much choice. And then right-wing politicians will be able to finish off that job by big corporations and sell it to the public by saying, well, we have to agree with this because we have no other choice. But we always had a choice, and that those choices are being made right now by our very own government. And the irony of it all, and I've said this before, but it just still strikes me as so sad, is that such a massive PR stunt, PR angle of the right-wing Brexit campaign was, you know, we need to control our borders and you know, shut down our borders and be out of the EU human rights and migration system, which itself is very draconian, because refugees and migrants undercut the wages of good citizen workers. And, you know, that higher living expenses and essential pay freezes, stagnant wages are the fault of undercutting migrant workers. So we need to sort of draw the bridge up. And that's why we need to have Brexit. But it was Brexit in the end that undercut the wages of and the conditions of workers in this country. So it turns out that all along, solidarity with migrants and solidarity with migrant workers, rather than with the crusty English upper classes, was always actually key to maintaining and improving working conditions and wages. Who could have known? Who suggested that in the past? I wonder. But you know, that's the kind of sad tragedy of the whole thing, really.
We're going to close the show with a couple of super chats. Oliver Cant with a £5. Will the NHS collapsing be used as a backdoor for introducing 100% US-style private healthcare system? Potentially. I mean, that's definitely going to be a fight to have after this, isn't it? You'd hope that the result of this pandemic is going to be to say, let's properly fund the NHS so it has spare capacity for when disasters do happen. But we can, never. You'd be a brave person to predict that things couldn't get worse after this pandemic. Chanter with £20 says, I've had a reminder set for 365 days not to forget this. Could you give a birthday shout out to my partner, Regina Lazarenko, for the 17th of January? Both our avid listeners. Keep going. Great work regarding this, Goran. Thank you so much, Goran, and happy birthday to Regina. I'm also going to add happy birthday to my sister for yesterday and happy birthday to my mum for tomorrow. I'll do some sort of super chat to Novara Media in our internal channels so that was a legitimate birthday shout out. We've also got Isabel Keating with a tenner. First time I've watched live. Just want to thank Michael, Dahlia, Ash, Aaron and the Novara team for all you do. Can't express enough the importance of your work and your voices. Isabel Keating, that's so kind of you. Thank you very much. We will be back on Monday at 7 p.m. as ever. Dahlia, thank you so much for joining me this evening.
Thanks for having me.
And you've been watching Tysky Sour on Novara Media. Good night.